How to tell apart lung cancer fatigue from treatment fatigue. Imagine feeling exhausted all the time, but not quite sure if it's the cancer wearing you down or the treatments taking their toll. That's a common question for many with lung cancer. Both types of fatigue can feel overwhelming, but understanding their differences can help you manage them better. Lung cancer fatigue, often called cancer-related fatigue, is a deep, persistent tiredness that doesn't go away with rest. It can happen at any stage of the disease, even before diagnosis, and tends to get worse as the cancer advances. This kind of fatigue is caused by the cancer's effects on your body, like inflammation, changes in how your body uses energy, poor nutrition, and reduced physical activity. It's often accompanied by feelings of emotional distress, difficulty concentrating, muscle weakness, and a general sense of exhaustion that can seem all-encompassing. Because it's linked to the disease itself, it tends to be ongoing and not easily relieved just by resting. Treatment fatigue, on the other hand, is directly related to the therapies used to fight the cancer, such as chemotherapy, radiation, targeted therapy, or immunotherapy. This type of fatigue usually starts during or shortly after treatment sessions. It's often tied to side effects like anemia, inflammation, tissue damage, and the body's efforts to repair itself. Treatment fatigue can fluctuate depending on your treatment schedule. For example, it might be worse right after a session and improve during breaks. Sometimes it can linger long after treatment ends, especially if side effects like nausea, pain, or infections develop. One way to tell them apart is by looking at the timing. If you start feeling extremely tired before any treatment begins, it's more likely lung cancer related. If the fatigue kicks in during or right after treatment, it's probably treatment related. Another clue is how the fatigue responds to rest. Cancer-related fatigue tends to be persistent and doesn't fully improve with rest, while treatment fatigue might get better during breaks from therapy. Associated symptoms can also help differentiate them. Lung cancer fatigue often comes with depression, anxiety, sleep disturbances, and nutritional issues. Treatment fatigue might be accompanied by side effects like nausea, pain, or infections. Both types can feel all-consuming, but treatment fatigue might fluctuate more depending on your treatment schedule. Understanding the causes is also key. Cancer fatigue stems from the systemic effects of the tumor, like inflammation and metabolic disruption. Treatment fatigue results from the side effects of therapies that damage healthy cells and trigger your body's repair processes. In clinical practice, doctors look at your overall health, your cancer stage, your treatment timeline, and other symptoms to figure out what's causing your fatigue. They may use questionnaires or blood tests to help identify factors like anemia or depression that could be making you feel worse. Managing these types of fatigue involves different approaches. For cancer-related fatigue, improving nutrition, staying as active as possible, and addressing emotional health can help. For treatment fatigue, adjusting therapy schedules or providing supportive care like medications for nausea or pain can make a difference. If you're experiencing persistent or worsening fatigue, it's important to talk to your healthcare team. They can help identify the cause and develop a personalized plan to improve your quality of life. Remember, fatigue is complex and varies from person to person. Getting professional advice ensures you get the right support tailored to your needs.